Greetings, I'm Keith Klein, the host of the VentureFizz podcast, where I interview the most fascinating people in the tech scene. This is episode 338, and today's guest is Tasneem Dohadwala, founding partner at Excelestar Ventures. It's a lot more common to find VC firms that are investing into deep tech or hard tech, but when Tasneem started Excelestar Ventures in 2010, it was far from the norm. Not only was it abnormal to invest in companies building highly advanced engineering products, but it was also a very challenging time in the tech industry in general. So to start a new VC firm at that point in time was very rare. Excelestar Ventures is a bit different than most VC firms as they operate an evergreen fund, which gives them flexibility, especially during different economic cycles in terms of the types of investments that they can make versus having to raise a new fund every 2 to 3 years. The firm is also very passionate about funding disruptive businesses led by underrepresented founders. Across Excelestar's entire portfolio, 61% of their companies are minority-led and 50% are female-led. In this episode of our podcast, we cover lots of great topics like fundraising advice for women or minority founders and why you should always be thinking about asking for introductions, Tasneem's background story and how she got her career started in finance, plus her decision to go back to B school at HBS, all the details about Excelestar Ventures in terms of the companies that they are targeting, including her interest in personalized medical devices and how their due diligence process works, Tasneem's involvement with Golden Seeds, a firm focused on investing in women-led companies, advice for pitching your company, and the importance of being able to properly articulate the value proposition of your company, having the right market size for that investor, and another factor that she calls the confirmatory mindset, and so much more. Okay, quick side note. I'm not sure if you caught this yet, but VentureFizz launched a new invite-only offering called VentureFizz Communities. It connects people in specific job functions with the opportunity to grow their network, learn from each other, have access to a centralized library of resources, job opportunities, events, and more. The first community that we are building is focused on product managers in the Boston tech scene. So if you fit the bill at any level of experience, go to venturefizz.com/communities to request an invite. All right, without further ado, here's my interview with Tasneem. Tasneem, thanks so much for joining us.
Hi, how are you? I'm excited to be here.
Likewise, we got a lot to talk about because you're an investor and you've done a lot throughout your career. And I think it's impressive how you've built your career. That is, I talk to a lot of investors for this podcast. And when I saw your background, I'm like, wait, there's a lot here that is not your traditional path to venture capital. So we're going to talk a lot about that and the types of investments you're making. But to kick things off, I mean, I think your firm, and I notice you've been speaking about this and you write about this, about helping women or minority founders around raising capital, which is something that is absolutely needed. So I wanted to get your advice if you are a woman or a minority founder, what should you be thinking about as it relates to raising capital?
So first of all, I think the most important thing is to look for mirrors, and I'll explain what that means in a second. Who are these investors? It doesn't have to be necessarily an investor, a mirror in the investor itself. I mean, it always helps, right? If your lead partner is a female, that's always, I think, going to help you. But mirrors in like their portfolio CEOs. Do any of the CEOs look like you? Do the companies look like kind of what you're investing in? I think if you see some synergies across the board in their portfolio, you're probably going to have a better time raising money from there. Another piece of advice, focus on dry powder. Make sure they have dry powder before you spend lots of time building a relationship. Lots of VCs will take the money a lot of VCs will take the meeting. That doesn't mean they have the money. So you need to make sure that they have dry powder. You have limited time. You need to make sure you focus on those that can actually invest in your company and make sure that you're ready to invest in the relationship. It is very much about the relationship when you're raising money. So allot time for that. A lot of entrepreneurs don't allot enough time to build a relationship, and they get themselves into a situation where they're really trying to scramble because they're running out of time. And keep asking for introductions. If someone says no, we'll ask for an introduction. It's very rare that I say that there's nobody I can not connect, that I can't connect you to somebody. There's always somebody I can connect you to. It could be another investor who I think is a good fit. It could be an advisor that could be a good fit to help you along the way. I learned very early in my career that to build a network requires a lot of hard work, and you have to ask for introductions.
I think that's a great piece of advice. I don't know if that's been really fully flushed out as it relates to you come to the end of the process with a potential investor and they do pass and it's disheartening, it's disappointing. But okay, now let's still leverage the relationship that you've developed with that investor to still hopefully connect the dots to somebody else.
Yes, because it could be that it's just not a good fit for them, or it's not the right time in their fund, or but they may know somebody that it could be a better. I mean, they may know an earlier stage investor where it could be a better fit for them, or a later stage investor, or an investor that just closed a round and you're the sort of perfect fit for their thesis. And there's always room for somebody to help you. I think generally people like to help each other, and especially women like to help women, and those that are of minority background like to help those that are of minority background. So I think
Yeah,
you're bound to get some help.
yeah, absolutely. All right, let's rewind the clock. So,
Sure.
where did you grow up? What were you like as a child?
So I grew up actually really close to where I am now. I grew up in Reading and Andover, Massachusetts, so north of Boston. So I'm pretty local. As a kid, I loved being outside. I liked swimming and I liked, riding my bike and playing in the playground. I spent lots of time. I have a really big extended family close by to me, and I feel really blessed because of that. And I spent lots of time at other people's houses and enjoying with cousins. And so I had a very much a quintessential childhood. I love to read. I still love to read. So I spent a lot of time reading if I wasn't outside biking for hours and, in and out of neighbors' homes. So yeah, I had a really great childhood. I also had a childhood that was very much focused on academics. My parents were immigrants, and private school was a big commitment for them, and they still made it. And they made sure that they it was sort of ingrained in us that you tried to go to the best educational institution possible that you could kind of get yourself into. And when you got there, you worked really hard and you were always curious and you were always trying to seek to be better, not in a competitive way, but better, in competing with yourself. And so that's sort of my background.
Cool. So you attended Wellesley College. What prompted the decision to go there?
Yeah, I mean, most people now spend lots of time researching their college. I was sort of process of elimination. There were a lot of schools that I went to and I was like, wow, this is not a good fit. And then I ended up being at a dinner with family friends, and they asked me, and they were Wellesley grads, about 15 to 20 years senior to me, and they asked whether or not I was going to be applying to Wellesley, and I sort of was like, no. And they were on it. I mean, they hard sold me all dinner long. And it felt, I mean, the idea that someone felt so excited about their alma mater was sort of really unique to me at that point. And so I applied early decision, and the rest is history. I mean, I didn't even visit campus until I got in, and I loved it. I mean, it's a beautiful campus. I had an amazing time. Professors were amazing. I have made best friends that I'm still friends with now, and one of the best educational experiences of my life. I mean, I've been really privileged to go to some really amazing institutions, and they've all sort of made a lasting impression on me, and Wellesley's right up there, and I'm still really connected to the school. I'm on the President's Advisory Council, and I find always a reason to go back to the school. So yeah, it's a great experience for me.
So how did you get your career started after graduation?
Well, I went to Lehman Brothers. So I actually, it was pretty well defined that if you wanted to go into business after Wellesley, you were either sort of on the finance track or you were on the consulting track. And you had to land that junior internship, summer internship, in order to be gainfully employed after senior year. And considering I wasn't planning on going to medical school or law school, I said, well, I better get gainfully employed. So I applied to several finance internships my junior year, and I didn't necessarily quite know which financial path I was going to go down, but the Lehman Brothers sales and trading option seemed to be the best option for me. And I ended up there, and yeah, it was the best experience for me at the time. And I will say that I was so, I got assigned to a fixed income sales and trading desk, which, as you can imagine, is an incredibly quant focused, super intense, fast paced environment. And I think at first my managing director was sort of annoyed that he got assigned me, like, I got assigned out of all the summer interns, he got me. And he looked at my background, he's like, oh, a sociology major and a math minor, like basically, what the heck am I going to do with you all summer long? You're going to be kind of this annoyance in my side. So he gave me this stack of derivative books, books on derivative instruments, and was like, basically like, go home and study, and I'm going to regularly quiz you, and your performance on the quizzes will directly impact whether or not you get a full-time position. So I said, well, okay, well, the one thing I know how to do is work hard and study. So I got on my task and started studying derivatives, and I kind of loved it. I loved being in that environment. I know the sales and trading. I mean, it was really very much like what the movies sort of show. This loud, super male dominated, pretty intense, pretty aggressive environment where people are yelling trades at each other. One of my jobs was answering the phone and basically yelling out who was on the phone for who. And it's kind of intense, as I don't know what, I was like 17 and I had to kind of yell out. And I still remember this person who called from the UK desk. He was looking for my managing director, and I couldn't understand how he was saying his name. And I kept asking, and he finally started swearing. So I just basically said whatever I heard, and my MD was like, who is on the phone? And I said, oh, I don't even remember what I said at the time. And it's been some years. And it was some basic name. I still remember that. And my MD was like, wow. He's like, do you need hearing aids? And I said, I couldn't understand through his accent. I'm sorry. You know what? It was fine. It was, we all laughed about it. In the moment, I was definitely like very, very embarrassed. But, as I reflect now, you grow a pretty thick skin after an environment like that. You learn to study outside of sort of an academic setting. You learn to make yourself useful, even if it's a task that you think is menial. I remember my MD was like, I'm sure you think you're highly qualified for this job, and that I'm asking you to, get coffee and get burgers from Peter Luger's, and you're way too educated to do that. And I said, I'm willing to do whatever it takes to help you do your job. And that's basically what he expected, that we make ourselves helpful. And if we get even the little things right, that allowed him to have more trust in me. And so he started giving me more and more things. And by the end of the summer, I was trading. And then, I did get a full-time offer, and I actually moved to equity sales. I moved out of fixed income. I had a great time there. And my managing director, actually, I had two managing directors and an associate. I ended up getting promoted. And actually, my sort of highest managing director ended up writing my business school recommendation. So it all worked out really well. And I was in business school when Lehman Brothers finally collapsed.
Mhm.
So it was bittersweet at that time. So, but it was a
Yeah.
great experience. I'm very glad I started there. I have zero regrets. It was definitely training by fire.
Well, so a perfect segue. So what led you down the path of going back to B school at HBS?
Yeah, I mean, I kind of knew I always wanted to go to B school. I never thought that I was going to stay. I mean, I thought that maybe one day I'd come back to an investment bank environment. So that was sort of in my mind. But I knew in college that I wanted to get some postgraduate work. And then once I kind of pivoted into finance, the most sort of natural segue was B school. I knew I didn't want to do law school. I knew I didn't want to do medical school. So yeah, so that I knew I eventually wanted to go to B school. And by then, very honestly, I was already a mom of a little guy. So who is now not so little. But anyways, I knew that at some point, if I stayed at Lehman long enough, the inertia to stay would have been really intense, because as you keep getting promoted, and basically everybody except for my managing director who wrote my recommendation, who did go to Harvard Business School as well, basically everybody around me was like, why are you going to B school? You're going to leave so much money on the table. This is going to be such a waste of your time. You don't even need B school to be successful here. And I sort of pushed back and I said, no, I'm going to go, because if I don't go now, I'm never going to go. And yeah, and so I went, and it was fortuitous, because this when the market fell apart, basically was when I was in B school, and everybody was trying to get into B school as I was sort of graduating. So it all kind of just worked out for me. And it was a good life transition time for me as well, because my husband was doing his medical training. And so it just all fell into place. But yeah, it was the right decision for me. I needed to go back to B school. I needed sort of a deeper business understanding, and just the way you learn to think, based on what your professors teach you as well as what your peers teach you, was really informative. And while I think that maybe the first few years of my career, even in venture, I'm not sure. I was like, oh, I don't really know how B school helped me. But now, as sort of a decade plus out of B school, a lot of lessons and a lot of sort of that sort of business sense that you develop from business school, it's all coming into play now. I can see it. And I think if I hadn't gone there, I think it would have been more challenging for me now.
And then during this time, you had an internship at Matrix, so
Yeah.
it opened up your eyes to the world of venture capital. How did that come together, and what were you working on during that time frame?
So, I mean, I just use personal networks to get to Matrix. I mean, Matrix doesn't really hire a lot. They're a pretty old school firm, and you kind of have to use your network to get there. And I was lucky enough to be able to do that. It was a great experience. I still remember, and this lesson has sat with me forever. And I would give anyone who's interested in venture to keep this one in mind, which is, my managing director sat down with me like literally the first day, and he said, look, if I see you in the office more than 30% of the time that you're with us, you're not doing your job. And I sort of was like quizzical when I looked at that. I was like, okay, well, where do you expect me to be? And this was before, work from home and remote login. I mean, it was literally like you work at the office. There was no work from home back then. And he said, no, I expect you to be meeting people. You should be meeting experts. You should be meeting entrepreneurs. And that's your job. Your job is to fill your calendar with meetings, because the more people you meet, the better chance you will have of finding, a fundable company or understanding market trends. And so you need to be out there meeting people. That is literally your job. And that has sat with me forever. If we are not actively deal sourcing, whether it be attending events, doing things to get the firm's name out there, or, talking to our current CEOs and seeing what they're seeing, and, talking to physicians about companies that we're investing in. I mean, if I am not talking to people on a regular basis, like my calendar is not full of that, I feel like I'm not doing my job.
Yeah, no, absolutely. That's a big piece of any
Yeah.
job, but especially a venture capitalist.
Yeah. Yes.
Um, so you went on to work at one of their portfolio companies, Care.com.
I did. I actually started working there before graduation. I started it sort of like as a project, and then it turned into a full-time position in business development. I wanted to try, right? I mean, there's two sides of the sort of, you can either be a coach, and this was actually another thing one of my MDs had told me at Matrix. Venture is very much like coaching from the sidelines, and you are going to coach lots of different games, so you get that variety. But you're going to be a coach. You don't get to be, Lionel Messi scoring, the winning goal. You're on the sidelines, and you're coaching from the side and learning how to persuade and support from the side. Um, if you work at a portfolio company, you are one of the players. You are in the mix, but you are in the mix of one game, one intense game. And that focus is going to be, is sort of that depth is something that you're going to have to love. And so I said, okay, well, this is the time to see which side of the coin do I like better. do I like the portfolio company, the like being a player on the field side, or do I like the coaching side better? And then that was sort of the fork in the road. And so I decided that I would try a portfolio company. I went to work at care.com and, uh, well, it's obviously a very amazing company that had a great, great run, and it's done so well. And it just wasn't the right fit for me. It was really nothing to do with the company. It just wasn't exactly what I was looking for at the time. And I think based on what I learned at Lehman about myself, it's the pace and the variety of work that really intrigued me. And with venture, you have so much variety of work. You get to sort of constantly educate yourself about what's going on, and trends are moving, and there are new entrepreneurs coming up with new ideas, and that heterogeneity was exactly what sort of floated my boat. And so I knew care.com wasn't going to be the right fit for me. So I left actually really quickly after graduation with zero plan, which is not a very Harvard Business School thing to do. I didn't have an option to go somewhere else, and I was just sort of gonna freewheel. And it was a little funny because my husband said, "So you've not been working for 2 years while you were at business school, and now you quit your paying job during the worst economic time, and I'm still training to be a physician. This is great news for us." I said, "Oh, it'll be okay. It'll be okay. I'll get a plan. I'll get it together." And I did get it together. So eventually, it took some time though.
Well, this is, I kind of gave a little hint of this in
Yeah.
the intro that, your path into venture, you had the internship at Matrix,
Mhm.
but then you did end up starting your own firm. So let's talk about the creation of that, because it is uh in 2010, I think it was, that it was very abnormal. Like you
Yeah.
see some funds popping up now.
Yeah.
It's not the norm, but it happens. But when I was looking at the dates, I'm like, wait, this is very rare to have someone,
Yeah.
like I was like, wow, this is awesome.
So I mean, what basically happened was I realized, so first of all, there was a little bit of an opportunity, right? The big funds, the mega funds, they were going to be fine. They were going to sort of ride the wave. And we were getting, and again, I had really great coaching from those at Matrix, and they were basically saying, like, this is such a tough time, as you can see. I mean, I think 50% of the venture funds folded between something like, 2009 and 2010, and it was pretty rough. And so, you know, but people still had money, and they still like the asset class, one, and two, the markets were very volatile, and so people wanted to figure out ways of places to put their money. And I didn't, raise a huge fund, but I was able to raise a small enough fund with a very specific thesis around deep tech, before deep tech was sort of coined as a very cool term. But basically my thesis was around saying, well, if you really focus on highly advanced engineering or highly advanced scientific um, scientific underpinning type investments, well, then you're going to do better because your fundamentals are focused on the technology and best of breed technology, and therefore you can win. We started that thesis with 3 different sectors. So it was healthcare, which was not specific to med device. So diagnostics was in there. We were looking at therapeutics. We didn't make a therapeutic investment, but it was healthcare. The only thing I think we never really were intrigued by was healthcare tech, so like health tech. So just healthcare, high tech, so your traditional technology companies, and energy. And because energy at that time was just burgeoning into, now we call it climate tech, but at that point, I think it was called renewables. Like, I don't even remember, but it wasn't climate tech back then. We realized that energy wasn't a good fit. You needed a lot more capital than we had, and you couldn't. It itself was such an intense ecosystem and so complex at the time that you can't be an energy investor, a med tech investor, and high tech investor. That just, it wasn't. We didn't do well. We had made a few investments, they didn't do well, and so in sort of as time went on, I sort of pulled that out of our thesis, and I said, we're not going to do this anymore. I actually recently started thinking about it again, and sort of veered back to say, no, we're going to stick with our fundamentals because they're working for us. And then with the healthcare, we actually started focusing more on medical devices. We did a diagnostics company, and I think diagnostics, again, I sort of pull that out of our thesis as well. I don't think it's quite the right fit for us in terms of the size of the investment and the bar. What I've learned is the bar to make diagnostic companies successful is just much higher than I think you are a diagnostics investor or nothing and nothing else, right? So I think we pull that out as well. So we've been refining as time has gone on. And in terms of tech, I think with our med tech, we're willing to invest sort of a mature series seed or series A. We're able to even go in a little earlier if we feel like we have a history with the entrepreneur or the entrepreneur's experience. And in high tech, I think the bar is a little higher. We're really more looking for definition of product market fit. So, with med devices, we're going in pre-FDA, pre first in human. But with tech, I think if I had to compare sort of the maturity of the companies, we're looking for companies that have already had traction with customers before we write a check. So their product has to be a little bit beyond the minimally viable product, and they need to have shown that they're on the track to going sort of from a commercial or so from a pilot the pilot phase to a more of like a scale contract. So that's sort of the stage of where we're at. And our fund is evergreen. And so we haven't had to go out and raise additional rounds. We were lucky enough to have exits early on. And so money has been plowed back in. And so we still have dry powder, and we're able to support our companies because of that in a really agile way. In times like this, where a lot of companies are going to have done bridges to sort of get to the next more exciting milestone to be able to raise the next round, hopefully at an uptick. We're able to really participate in subsequent rounds and support companies in a meaningful way. So hopefully that was like a lot, but
yeah, but you covered a lot, but it was definitely like unique where most VC firms, from what I know, and I'm not in the role, but it seems like if you're an active firm, you have the life span of a fund is 10 years, but if you're not raising every 2 years or announcing a new fund every 2 years, you're kind of like not really in the game anymore. So if you're one of the managing directors or partners, you're constantly raising from your LPs while you're still trying to fund companies and distribute and allocate the funds that you raised. So it just seems like this cycle, whereas you're in your firm, you could focus on the entrepreneurs.
Yes, and we do. And I think that the traditional model is fine and it works for most, but I think the problem is, at least with medical devices, I think tech is a little different, but with medical devices, the timelines have really moved out. There are very few. So first of all, when the IPO market is closed, which it has been, you lost one of your exit opportunities or sort of your exit avenues. That's one. When sort of companies, your standard acquirer companies are also sort of getting a little battered in the market with their stock price or whatever it may be, they're going to be less acquisitive as well. And I think that they're looking for more accretive transactions during tougher markets. They don't want a company that's going to sort of be dilutive to their stock price in terms of how the market sort of perceives the company, even in an acquisition. And so if you're not getting those exits, there's acquisition or there's IPO. There's not that many options. It's really hard to raise because people want to see that you know what you're doing. And so I think with medical devices, especially when you're going after large markets that we are, you're looking at longer timelines to exit. And you're talking about more money raised and a higher bar of achievement before somebody wants to acquire you or you go public. I mean, public is a little bit more fickle, in my opinion. So it's a different model that we have, and I think we're lucky that we have it. And I think hopefully our entrepreneurs that we invest in think that they're lucky to be partnered with us, because I think getting us to write sort of your next pro rata check is a little bit less sort of dependent on what's going on externally with our fund.
Now, the areas, you talked about deep tech, investing in deep tech before it was a thing that's very common now and like
Yeah.
cool, like for lack of a
Everyone
better
thinks
term,
they're
cool.
investing in deep.
Right, exactly. So how did you start to, because these areas that you're investing in are very difficult, yet you don't have the background per se. Obviously, you're smart, but so did you just follow what you learned at Matrix of like, I need to just talk to every expert and fill my calendar, and the more people I talk to, the more I'm going to understand, the more I'm going to find the investor, the entrepreneur to invest in.
Yeah, so our diligence process is pretty intense. Not I try to not make it intense for the entrepreneur. It's intense for me. And the principal that works for me, she's also fantastic, and she's an MIT Sloan grad. She's a female as well, which is really exciting. And we have a quantitative and we have a qualitative approach, super research based. So first of all, so if you just take on the med tech side, we spend a lot of time reading. Each one of our med tech companies will have sort of a body of scientific evidence that they're sort of building off of, that was sort of built up by other researchers or other companies that came before them. And we spend a lot of time reading that. We spend lots of time doing primary research with physicians who would be using whatever device that we're thinking about investing in. And we spend a lot of time also talking to engineers about sort of how does the device work and what do we think about it. And that takes time, but we definitely focus on it and do it as rapidly as we can, because we know these companies, need at least an answer. So it's iterative, right? So we initially start with rounds of questions with the companies where we're trying to peel back the onion and try to get the big questions out first, and then sort of slowly dig sort of deeper and hone in on where we would sort of think about, where we think we have the most questions. And I always start with a diligence map. And the diligence map stems from one really easy question: what do I need to believe to invest in the company? And then I keep going from there, and we kind of keep going down deeper and deeper. And then it's obviously informed by lots of primary research. And then, so when I said quantitative and qualitative, so we have the qualitative report that is sort of an evidence, sort of the amalgamation of all this independent research that we do, as well as all the research sort of gathering that we've done with the company, primary research and interviews that we've done with providers. Then we have something called the quantitative matrix. So we actually have 6 or 7 categories, and we sort of rate the company in each one of those categories, and it has to have there's a certain threshold score that the company has to have in order for us to consider an investment in it. And I sort of rate each category independently, and my principal does the same thing, and then we compare notes. So we also try to take bias out, right? We all have our own biases about entrepreneurs or how they may present, or specific industries. And this sort of quantitative approach to diligence allows us to sort of take some of that subjectivity out of it. Obviously, it's subjective of how we rate it, but the fact that each company that we get serious about goes through this, it allows us to say like, oh, like this med device company was rated this, and we made this type of an investment, this size check, and whatever it may be, and this one is coming out to be here. What do we think about that? So I think it's a really interesting approach that I've sort of that it's been I've been working on it for a little while, but it definitely does help sometimes sift out where I'm definitely at a crossroads. I've done a lot of research and I feel like I'm ready to make an investment, but I'm not. There's something that maybe isn't, really pushing me over that edge. And I can look at that matrix, and it helps me kind of, again, hone in on what could be sort of nagging at me, or what it pushes me over the edge. Say like, you know what? No, you actually rated it really high, and we got to take the plunge, because in the end, venture is all about making imperfect decisions in an uncertain world without a crystal ball. So there's a lot of stuff in there, and you got to just do the best you can to sift out an answer with sort of pieces of information.
Well, to layer on top of that, there's times when FDA comes into play
Yeah.
and manufacturing. And so how do you advise companies when it comes to those layers? It's hard to build a company and build a product, but then FDA approval, manufacturing, like all these complexities that add on top of it.
So with a lot of our companies, there's been predicates that have gone out there, right? And they may not be using the predicate, like they're still going to do a PMA approval or a 510K de novo approval. They even some of our companies have breakthrough designation, which is fantastic. But there are companies that are akin to what they have done. And so we do always want to understand like what model are you looking at in terms of where are you going to do your clinical trial? How big is the clinical trial going to be? When are you going to get into a human? What is that product going to look like when you get into human? How many first in human patients are you going to do in your feasibility trial? And then how big is the pivotal trial going to be? Is it going to be randomized control? Is it going to be, is there not going to be a control, right? Like, there's so many elements, and we do not expect to be the expert. And frankly, I don't even expect my CEO to be an expert. Either I expect the CEO to have hired an expert who's done something similar, or they are using consulting firms to help them sort of design the trial. And they're getting a lot of advice about trial design from their medical advisors or their clinical advisors. And so that's where that scientific advisory board, I want to make sure that they are talking to them, because I think the other thing is you want to see a CEO that never thinks they're the smartest person in the room, because if they do, I think it's going to be a disaster. I never think I'm the smartest person in the room either. And so, is this CEO surrounding themselves with advisors, consultants, team that is complementary to them and is sort of filling in all the gaps of knowledge? Because I actually think FDA can be more prescriptive in terms of what you need to do to succeed, and where sometimes it can be a bit of what I would call a very sort of little bit of a black box is reimbursement. And there are just so many prongs to reimbursement. And you really do need to have that type of expertise to execute on the multiple levels that you need to do in order to get significant, to be successful in the reimbursement sort of landscape.
What are some like the portfolio company examples?
Yeah, so some that have exited, we can talk about that. Like, we invested in Augmentics, and they exited to Boston Scientific. That was super successful. They were commercial. So they went through and did a PMA trial, and then they sort of fought the battle, and they gained reimbursement at a great rate. And then they were able to build early commercializability evidence. And then that's when they finally were able to exit. So,
What did they build? What is Augment?
so Augmentics basically has created and actually the product is out there now. It's called SpaceOAR, and it is a hydrogel that gets inserted between the prostate and the rectum in order to protect the rectum when the prostate is getting radiated during prostate cancer therapy. And so, the thesis was that, right now patients have to undergo something like, 30 to 40 sessions of radiation, because you can only give a certain amount of dose of radiation because of the toxicity issues, the rectal toxicity issues. And if you're able to move the rectum out of the way, and you can just better target the prostate, then you theoretically could give higher doses. And they've actually started doing that now, in order to so you can really shut down you don't need to have so many sessions. So there's a cost savings there as well. So that was one of the companies, and that was the CEO there was the original CEO there was Amar Sahni, who is a prolific entrepreneur in the area. And he's just a fabulous operator. And he actually ended up hiring a commercial CEO post to sort of take the company through early commercialization. Reimbursement was a brilliant move on his part. When you talk about really brilliant CEOs knowing their limit, knowing what they know and knowing what they don't know, he very much knows what he's really good at, and he does that really, really well. And he hired a CEO at the right time, the right person, and ended up really optimizing a fantastic result on the company. So I have lots of respect for him. So he's a wonderful guy. So.
All right. So on top of this, you're very active with golden seeds too.
Yeah. And they do amazing work. I mean, they're mandated to invest in female founders. They have been doing this again. I mean, I hate to say this, but it's sort of become recently in the last 5, 6 years, like very sort of trendy to have a female focused fund. And I'm glad, I'm really happy that there's so many people out there, but they've been doing it much longer than a lot of people have been doing it. And so I give them a lot of credit. They're a national organization, so they have investors across the nation, and they're industry agnostic. So it's always been I have been always very passionate investing in women. And so it felt like a really good fit to sort of get connected with them. Obviously the companies generally are pretty early, but it does allow us to do a lot of, deal sourcing and networking, and we get to support these companies early on, whether we invest or not, in terms of, helping them. And then when we do, when we do make an investment, we do a small toehold, and then we're able to do larger checks later on. So it actually works out really well, and it's a great organization.
Like, is it like how does it differ between the two? Obviously, there's the what you're focused on with your existing firm, and then the Golden Seas. Like, how does it differ?
So I used to be Boston chapter lead there, and that was, that ended up being a lot while still running a fund. But basically what I try to do is I try to, make sure I make all their monthly forum meetings. So I'm seeing sort of their top companies, and then we decide whether or not we want to participate in diligence. And it's kind of nice because this is sort of collective diligence that gets done. We don't have to do all the diligence on our own. And that allows me to sort of leverage our time a little bit better. And then we decide whether we want to invest or not. In terms of, I would say my principal is now more involved. She does a lot more of the office hours and the coaching of the companies than what I used to do. But as sort of time evolves, and I do sit on a lot of boards now, and so our portfolio companies do require a lot of my time. So which is great, and I'm happy to give it. I really feel like that's the best part of the job. So.
Yeah, well, I guess kind of relating back to Excelestar Ventures. So what are you like excited about? Like, kind of like what you're looking for future investments.
Yeah. Well, I could say AI just like everybody else, but I'm not going to say that. Actually, it's probably a much more nerdy answer, which is the personalization of medical devices. And so you see a lot of medical devices that are now coming onto the market, and they either have a way of the materials allow for conformability, or they allow for adjustability. So either to the patient's anatomy, or as a disease progresses, you're able to sort of adjust the way the device works, whether make it bigger or smaller or whatever it may be. Also, lots of really exciting sensing technology. So you're able to better medically manage patients, because you're able to get data that we originally weren't able to get. I mean, I'm sure a lot of people have heard about cardiomems, and the exciting to also read out in endotronics. And so now you're able to sort of better manage heart failure patients, because or just cardiac patients in general, because you kind of know how they're doing internally. And so you can more optimize medical therapy. And I think we've spent so much time thinking about sort of personalized therapeutics. And with these new materials and new sensing technologies, we're able to sort of personalize medical devices in a way that we weren't able to do before. And I think we're going to see more and more of that. And I think that's an exciting trend. Yeah, I'm excited to see where it goes.
So entrepreneurs, like, because you see so many and you invest in some, but like what are the common mishaps that you see, during the first meeting or the pitch or the through the diligence process? Like, what are the things that you're like, this just continues to happen and people need to know that this is happening?
Yeah. So I know this is going to sound these are two super simple things, but one is being able to really articulate very clearly right away what you're doing and why it's disruptive. And I know people are like, oh, the elevator pitch or whatever, but it's a little bit more complex than that. What exactly are you doing, and why is it going to alter, who are the stakeholders that it's going to alter? Yes, patient outcomes, but how does it change the health economics? How is it going to impact the provider? And And there's so many companies that just don't have a clarified sort of story when they get in. And I'm talking about in the first 10 minutes, if I don't know what you're talking about and why it's important, you lost me. And that's tough, right? Because I don't want to have to sift through and figure out what you're doing and why it's important. That needs to be very clear to me. And when you do it, I should feel like, wow, that's really unique. I've not heard about that. If I ask questions like, hey, I heard about these three companies that are kind of doing something really similar. How are you different? That's never quite the right. That means you're sort of down one certain path with me in my thinking, because I want to kind of be like, I really need to think hard about this. Like, wow, this is really unique. So that sort of sense is when I get excited. Market size. It is amazing how many people don't think about how they do a great job market sizing, but the initial market is pretty much what I'm investing in. And if the initial market is really small, and I mean like 200, 300, $400 million, it's going to be hard to justify such a large, we know these companies go on and raise like 50, 60, 70, 100, 80, a lot of money. And if the market is small, even if you quote unquote call it the first market, that's what I'm investing in. The first market is going to take long enough. And so we need that market to be large enough. And I'm thinking 750 is sort of the smallest market we're looking at. $1 billion is really where I get excited. So that, and then the third is it's a new thing I've been thinking about, is a confirmatory mindset. So a lot of entrepreneurs have a great idea and then they make sure, or they don't make sure, but they sort of get into this mindset where all the evidence confirms their hypothesis. And as an entrepreneur, you absolutely cannot ever have that mindset. You need to have a very open mindset. You have to assume that I actually think you have to have almost like a challenging mindset, as in every piece of information that you're finding out about your potential opportunity, how does it create a barrier for your success? So even in product development, if you just sort of feel like this design makes sense, why does it make sense? Why is this the best design? Not, oh, I think it is, and these are the reasons why I think it is. And that confirmatory mindset it's something I even talk to my companies about, right? Like, are you doing this analysis from a confirmatory mindset that you already kind of know what the answer is and you're just confirming it? Or are you going in with really open mindset and you're interrogating everything? And you can kind of sense from an entrepreneur, which are they sort of interrogating everything, or are they sort of just confirming what they already believe?
So the industry that you're focused on from an investment point of view, you're like in one of the greatest areas ever, Boston, right? Boston. So what's the current vibe of the Boston ecosystem?
I think I just went to a breakfast last week, and the one thing, it was actually a female-focused breakfast with female investors and female founders there, it was really exciting to be there. I'm glad I was there. Shout out to Jennifer for organizing it. So it was really great. However, and I feel, very jazzed about it. But the one thing that really struck me is the number of people that said we need to collaborate more. And I think that sort of is a little bit of a Boston thing. I don't know how much funds collaborate with each other. And I think in the end, most of the time, we're not the only, fund at the table. There's always a syndicate. And we do rely on CEOs a lot to create those syndicates. But in some ways, we would all be more powerful if we all worked together and sort of had our own syndicates I think West Coast does a little better job than that. So that's one thing that I think struck me at that breakfast. And I feel like I've been sensing it. I think in Boston, though, in general, there's so much opportunity. I think there's some great, wonderful ideas, amazing scientific research that's being done. I just think we need to maybe get a little bit more organized about how we invest in them. And I think if we're more collaborative, I think we can all be more, successful in doing so. But then I think in the general, like the time is a little tough, right? Like I think there's a lot of stories about there about founders not getting cash, it taking forever, 9 months plus 12 months. And that's really hard, right? To be fundraising for that long, lots of down rounds. So it's sort of, I wouldn't say it's negative out there. I wouldn't say it's optimistic. I feel like it's sort of neutral. It all kind of it's feeling like it's a constrained type market right now. But I still think that there's so much opportunity for investors as well as entrepreneurs. I think it's just about making sure you find the right fit between investor and company. Sorry, it wasn't as optimistic as I always hope to give, but that is kind of what it is right now. I wouldn't want to lie. It's not feeling so, you know, it's not feeling so bustling because I think everybody's working really hard and I think investors want to deploy capital, but I also think a lot of investors are sort of stuck sort of mid fundraise and there's some stuff out there. So
Yeah, no, it's I mean, I like to hear the reality of the market. And, I think people are certainly aware of the market conditions. And Jennifer is great. She was a guest on our podcast, so Mendoza Ventures. And the point of more collaboration is a good thing. So hopefully people start to do more of that.
yes.
Now, what are three apps you can't live without?
Oh boy, these are going to be really boring. So Google Drive, because everything mine, our entire fund is all of our work is on Google Drive. Second app is I love my Apple Health app. I'm a big fitness person. I love, exercising. I love getting my 10,000 steps a day. And so I'm constantly checking my fitness app. And oh wait, I had a third. I did think about this because I was like, oh, which ones do I use all the time? Which is what I'm going with. And here's the last one. I love my HBO Max or Max, it's called now app.
Mhm.
That is definitely my guilty pleasure. I love HBO shows. So yeah.
How about a good book or podcast recommendation?
Yeah, so it's not a traditional like business book, but I love it. And I want my kids to read it. My husband's reading it now. When Breath Becomes Air. It seems like a really tragic story about a neurosurgeon who ends up finding out that he has terminal lung cancer at the very early onset of his career as a surgeon. But he was also an English major. And then he trained to be a surgeon. And it is the most beautiful book about perseverance, resilience, and understanding the beauty of life, whether it be long or short. And I think every entrepreneur should read it, not because it's depressing, but I think it's actually uplifting. And the author who obviously has passed. His wife actually wrote, I think, the last one or two chapters because he passed before he could finish it. It is amazing the number of nuggets of life lessons you get in there. And I think as an entrepreneur, all those things are so important. I mean, he talks about basically as a physician, you're going to know that eventually you're going to fail at some point, right? You're not going to win every single patient. You're not going to win every single time. And despite knowing that you will fail, you continue to persevere. And I think that that's such an important lesson for an entrepreneur. Like there will be bumps. There will be lots of bumps. I would say every successful company has had a near death experience. And so knowing that you are going to persevere through that, it's really important. And that's why I love the book. It's really short, but it's beautiful and it's beautifully written. And it really sort of has sat with me for years. I think I've reread it like two or three times. So
Wow. So
yeah.
I love to hear books like this, because you get the hard thing about hard things, and like there's
Uh,
always like common books, but I've never heard of that book. And based on what you shared with me, like I'm gonna bump that up to the top of
yeah.
my, like I love how Spotify now has audiobooks that I like, because that's how I consume books. Like unfortunately don't spend a lot of time reading, but I do digest a ton of books through their audio. I used to have an Audible, app, but then when Spotify had all the books, I was like, this is great. So
Yeah,
anyways.
it is great. But I have to say I'm a traditionalist. I am still a pick up the book and read. Like right now I'm
Mhm.
reading Empire of Pain, which is about the Sackler family and Purdue Pharma and oxycodone,
Oh,
and the
okay.
crisis that this pharma company essentially created. That's a lot of stuff that I would not recommend entrepreneurs to do. So if you want to read about what not to do, you read that book. But it is,
Right.
you can also watch the Hulu series, Dope Sick. It's about the same thing, but Empire Pain is a beautifully written book. Investigative journalist wrote it. It's an incredible book.
Yeah, I did watch the Hulu series and it was shocking.
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 It is
Yeah.
shocking. And then
Yeah.
the sort of population of people that got impacted by it, it was really people that really needed it and didn't have an option, and how it had completely crushed communities. It's actually pretty heartbreaking what capitalism can do. So
Outside of work, what do you like to do for fun?
well, I do a lot of volunteering. I volunteered at our local community. I volunteer as chair of the board at the Pike School, which is the private elementary school my kids went to. So I spent a lot of time volunteering, which I do actually love. And I spend, as I said, a lot of time reading, and I love spending time with my kids. I've got 3 kids. I've got one almost about to get to college. It's a couple months now. He's in his senior year. I've got a freshman in high school, and I have a 5-year-old. And so lots of different things that I'm doing with them. And yeah, I love being a mom. And so I don't necessarily, it's not a hobby for sure, but I definitely do it outside of my professional work life. Yeah, that's how I spend my time outside of Excelestar.
Of course. Well, Tasneem, thanks so much for taking the time to walk us through your background story. Obviously, all the great information you shared as far as what you're doing in terms of the investment role that you're in, and obviously all the great advice.
Thank you, Keith. I really appreciate my time, and I appreciate the opportunity to be able to share my story.